Hello. Um, Hi, Tanya. My name is Christian Romero. I'm going to be your provider for today. Before we begin, we're going to be recording this video and uploading it to YouTube. I would like to have your consent. Can you state your name, full name, and date of birth, and then if you consent to be in this video?
My name is Tanya Romero, and my date of birth is 11/15/82, and I consent for this video to be uploaded to YouTube.
So we're going to today we're going to be doing what we call the HENT exam. So we're going to be evaluating, examining your head, your eyes, nose, and throat. Okay. If you have any questions or any concerns during the examination, please let me know. If you feel any discomfort or anything like that, just let me know.
Okay.
Okay. So first, we're going to be starting with examining or inspecting the head. I'm looking for symmetric head, no signs of asymmetry or any problems with the formation of the head. Then I'm gonna be doing inspection with palpation. So I'm looking for any bumps, lesions, hematomas, masses, any pain.
No.
Alright. Now I'm going to be doing what we call Sneller test. So we're going to be doing a vision test pretty much. So I'm going to be 6 feet away from you. So if you can close one of your eyes, and then if you can read this line from right to left, please.
FCLO.
Okay. And now cover the other eye. And then going from left to right.
OLCF.
Okay, now with both eyes.
OLCF.
Okay. So the patient has 20/20 on both eyes, right and left. Now I'm gonna be checking pupillary reaction. So I'm gonna be doing what we call direct and consensual. So if you can look at my finger, what I'm gonna be doing is putting the light to your left eye, looking for pupillary constriction. So this is direct. Now I'm gonna be checking the other eye instead while putting light on the left eye. So this is consensual, and both eyes are reacting. So now I'm gonna be checking the other eye, which is the right one. So if you can look at my finger over here. Okay. So before the lights, the pupils were a size of 4. Now it's constricting to a size of 2. I'm gonna be checking your eyelids. I'm checking the sclera, the iris, the lacrimal glands for any redness, any discharge, any pain. Have you had any discharge recently?
No.
Any excessive tears or anything like that?
No.
Okay. Any itchiness up on your eyes?
No.
And before we do the scope, I'm gonna be checking cranial nerves number 3, 4, and 6. So 3 is oculomotor, which is pretty much forming like an X. So any direction except medial or downward or lateral. Cranial nerve number 4, which is trochlear, that's the medial and downward. And then for cranial nerve number 6 is the obtusans, so that's gonna be lateral. Okay, so I'm gonna ask you if you can look at my finger and then follow it, okay? So at this point, I'm checking for any involuntary movements of the eye to check for nystagmus, which is negative. Okay. Now I'm gonna have you look at something in the wall, and then all of a sudden, look at my finger. Again, look at something. Again. There you go. So what I'm looking at is whenever the patient is seeing something on the wall, the eyes are more dilated, and then when she is focusing my finger, her eyes is actually constricting. So focusing on the on an object or my hand which is closer to her, which is accommodation. And also, I'm gonna be doing confrontation. So confrontation, I'm gonna have you occlude one of your eyes, whichever you want, and I'm gonna be doing the same. So let me know when you see my finger, okay?
I see it.
Okay,
I see it.
okay,
I see it.
okay.
I see it.
Now with the other eye.
I see it. I see it. I see it. I see it.
Now I'm gonna use my scope to check inside your eye. So I'm looking at the sclera. So first I'm gonna be visualizing with the right eye to her right eye. So safety mechanism, I don't want to hurt the patient and bumping her. I'm gonna have the patient look at something near the wall. So I'm visualizing the bed reflex going in and then focusing. I can see the optic disc, which is 1-3 ratio. And then the margins of the optic disc, it's sharp, which is normal. And then there's no hemorrhage or anything abnormal around the optic disc. Okay, so I'm gonna be doing the same thing on the left eye. See if I can turn you a little bit over here. So again, red reflex going in. So the optic disc, the same thing, 1-3 ratio. Margins is sharp, no hemorrhage or any macular degeneration. Now I'm going to be checking the nose. First, I'm inspecting for symmetry of any deviation on the nose. I'm going to have my patient occlude one of the nostrils. And I'm going to have this. Close your eyes. Can you smell this?
Flowers.
Okay. Now occlude the other. Again.
Flowers.
All right. Now, occluding one of the nostrils, take a deep breath. So like this. Okay. Can you breathe normally?
Mm-hmm.
And then the other one. And exhale. Okay. No problems with that?
No.
So let me know if you have any pain, okay? So I'm looking for the turbinates. There's no redness or any discharge, no mucus. Let me know if you have any pain, okay?
Mm-hmm.
So again, no drainage, no redness, or any irritation around the nose. I'm going to be checking the sinuses, which is a frontal. Any pain?
No.
Any pain over here? So frontal and then maxillary. Now I'm going to be checking your ears. All right. So first of all, I'm inspecting for anything abnormal, any masses that I can see, any deviation or any asymmetry between both ears. Okay. So if you can put it like this, I'm inspecting that ear, the tragus, which is right here, for any pain, any masses. And now same thing with the other one. Any pain?
No.
So I'm gonna be checking for the external ear canal. Do you swim by? Do you swim by any chance?
Yes.
Yes. So it's really important to keep your ears dry at all times because sometimes you might have a little bit of infection going on. It's very common for swimmers to get an infection.
Okay.
Okay. Any pain on your ear or anything like that?
No.
Okay. So for adults, I'm gonna be pulling up and back. So let me know if you have any pain. Okay. So I'm stabilizing my hand to prevent any pain to the patient. So I can visualize the tympanic membrane, which is pearly gray. The external canal, there's no irritation. And I can see the cone of light at 5 o'clock, since it's the right ear. Now I'm gonna be checking for the left. So up and back. Let me know if you have any pain, okay? So the same thing, there's no irritation, discharge, or redness in the external auditory canal. Tympanic membrane is pearly gray. There's no rupture or any redness or any discharge. Cone of light on the left is at 7 o'clock. So I'm gonna be doing a couple of tests to test your ear function, okay? So first, I'm gonna have you facing that way. I'm gonna be standing around 2 feet away from the patient. I'm gonna have her occlude her left ear, and then I'm gonna be whispering, what we call the whispering test, a two-syllable word to see if the patient can actually hear.
Football.
Now the other one.
Softball.
Okay. Now I'm gonna be performing what we call the Weber test, which is my turning fork. I'm gonna be slamming it or hitting on it. It's gonna make a sound, okay? I'm gonna put it on top of your head, and then let me know if you can hear it on both ears.
Okay. Yes.
Both ears, the same?
Yes.
So the Weber test is done. Now I'm gonna be doing the Rhinus test. So pretty much the same thing. I'm gonna be hitting my turning fork. It's gonna make a sound. I'm gonna put it in your bony prominence over here, behind your ear, and then let me know when it stops, okay? Once it stops, I'm gonna move it near your auditory canal, and then let me know if you can hear a sound.
I don't hear it.
Can you hear it now?
Yes.
Now I'm gonna be doing the same process to the left. Can you hear?
Yes. Yes.
Any questions for now?
No.
Alright. So now I'm gonna be checking your mouth. Just prepping the equipment. Alright. So for your mouth, I'm gonna have you first I'm inspecting outside your lips. If it's dry, maybe that you're having dehydration. But right now it's intact, pink colorish, which is normal. Okay, now open your mouth. So I'm checking her teeth. It's normal. And you put your lips on top. So gingiva is normal. There's no bleeding, any swelling.
No.
Not even on the lower.
No.
Okay. Now open your mouth again. Move your tongue to your left. So I'm looking for any vesicles, anything abnormal, any redness, discharge. Now to the other side. Okay, can you swallow fine?
Mhm.
All right. Now again, I want to see your tongue going out. There you go. Say ah. All right. So now I'm checking cranial nerves number 9 and 10, which is the glossopharyngeal and the vagus. I'm looking at the uvula that is actually moving when she's saying ah. And then again. So I'm looking at the tonsils. You haven't had any tonsillectomy or removal of tonsil, right?
No.
So the tonsils are size of 2. There's no redness on the uvula or anything like that. Now I'm gonna have your tongue put some resistance to the lip, inside the lip, like this. Okay. And then that's another test for another cranial nerve. Now I'm gonna check the neck. Okay. I'm gonna have you move your head down, which is flexion, back, extension, then lateral. I'm checking for a full range of motion. Now if you can push against my hand. Alright, now the other hand. Alright. Now I'm gonna have I'm inspecting the trachea of the patient. It looks like midline. There's no deviation or anything abnormal. I'm gonna be palpating the pre-auricular lymph nodes and the post-auricular. So pre, just in front, post, submandibular, submental. Any pain?
No.
Occipital, which is behind the head. So no pain?
No.
Okay. Supra. Supraclavicular. Any pain?
No.
I can't feel anything, any masses or anything abnormal. And inferior. So no pain. I'm gonna have my patient. I'm gonna be checking for thyroid. So I'm gonna give water to my patient. So here's your cup. So first, I want to see your how you swallow. So go ahead and swallow your water. Swallow it. So it's normal. Now I'm gonna be checking the thyroid. So I'm gonna be checking the same process, but going behind the patient. Now swallow. Okay. So there's nothing abnormal. Swallow again. Okay. So I couldn't feel that thyroid, which is normal when she swallows. Any question that you may have?
No.
Okay. If you have any problems or anything like that, as of right now, everything is normal. If you feel that something is wrong, please call the office. And again, if you're swimming, make sure that you're having dry ears because we don't want any fungus or any bacteria growing inside. And if it does, you might feel a little bit of pain, sometimes discharge. Sometimes you even might have fever or imbalance because your ears, it's for equilibrium. Okay. Alright. So if any questions, anything like that?
No.
Okay. So that concludes our video. Thank you very much.